there is a face to HIV/AIDS. It's not just stories that you hear.
Actually, when I was 6, I lost my dad.
HIV has a face. It has a face. These are real people.
It's an epidemic. We have to recognize that we have an epidemic.
Our staff work beyond what is expected of them, and they are committed to their work. They do extra hours of work. They have a lot of passion for their work, and they have a spirit of volunteerism, which you see in their day-to-day work.
This country had about 140 million people. And out of 140 million people, true statistic, they said about over 3 million people are infected. And out of 3 million people that are infected, you have less than 1 million on treatment. So it's something that the foundation could reach out.
HIV to them represents death, it represents gloom, that HIV represents, I'm not going to achieve anything in life.
As a doctor, I believe that my patient's well-being supersedes every other thing, and the ultimate joy I get is when I see the smile on the face of my patient. That is what keeps me going.
What drives me to do this work is I look at HIV/AIDS and the kind of burden it has become, especially on the patients themselves. The stigma of HIV, whether we believe it or not, is still there as much as it was years back.
The issue of stigma is so in-depth at the institutional level, community level, at the home church, but we're still working on it.
So to do that, we have to think of programs that complement each other, not just from the medical, clinical point of view, but from the social as well. We do not just isolate the person as a patient, but rather to be able to help that person in a more holistic way.
The client needs to know a number of things about HIV before he decides to run the test. Such information include what HIV really is, the difference between HIV and AIDS, the routes through which HIV can be transmitted from one person to another, how HIV can be prevented, and of course the counseling room is where those notions are dispelled.
The foundation is reaching out to people because, for instance, the drug resistant assay system is the only one available in the whole of the country. Without technologies in the laboratories, there is no way doctors, pharmacists could be able to achieve the objectives of giving health to any clients or to any patient that comes to them. Once you know your status early, you'll be able to plan your life.
So we have a huge number of people in Nigeria who require our services, and we need your support for us to be able to achieve this goal, for us to be able to change the lives of people and bring smiles to their faces.
I would say up to 60% of them will not be able to afford it if the drugs have to be, paid for. So I've built my dreams, around the vision of Gede Foundation.
Prior to the coming of Gede Foundation into this country, the country was actually doing one or two things on HIV and AIDS, but practically nothing. practically nothing was being done on orphans and vulnerable children intervention.
Under the social services program, we have the OVC, or Orphans and Vulnerable Children program, and the training.
What makes Gede special is because most times these trainings are part of a continuum of projects. Before we implement a project, we must definitely start with a training.
When we go into a community, we make sure that these programs are implemented in order to gain the trust of the community and to assure them that we will sustain the projects there for as long as we can.
We really don't need to do big things, just very little things. Build people's capacity, provide knitting wool for some children to be able to knit sweaters and all that, and it transforms people's lives. And that's why every day I wake up, I come to work or I go into the community with that zeal, because I keep liking what I see, the changes that occur after very little intervention. It's really amazing.
I tested positive since 8 years ago, and I am a mother of one. I formed a support group of people living with HIV because it was from Gede that we got the funding. I believe that Gede is going to do more because the children, all their hope is lying on Gede. Their future is lying on Gede.
There is a face to HIV/AIDS. It's not just stories that you hear, but you see the face to HIV/AIDS. You see children who are orphaned by AIDS.
It all started in the year 2003 when I lost my dad.
Actually, when I was 6, I lost my dad.
I need help from Gede Foundation, not because of anything, is that I lost my father when I was 7 years of age. So since that time, I have been facing a lot of problems. Since that time, I cannot further my education.
Without the Gede Foundation, there is no way they will have money to pay their school fees, because they would like to go to school and there is nobody to help them out.
We have also a monitoring tools that targets performance in school. We work with the head of the schools to also assess our children.
My hope is that when I become something in future, orphans and vulnerable children like me, so they will enjoy me very well, because the way Gede Foundation takes care of me, help me like this, that's how I want to help some students, some children, some orphans, vulnerable children like me.
We cannot just give them whatever they need. We have to make them feel that they can get it, because that is the best gift you can give them. To empower them, to give them the dignity that they are human beings and not just a charity case.
I hope for a better things. If I go to school tomorrow, I'll benefit from it. And tomorrow I can be a great person in life to help others the way they are helping me now. What I have to say to them is that I want to thank them first. Thank those that have been supporting the Gede Foundation and those that are working under Gede Foundation. I appreciate every one of them and I appreciate the good works they are doing.
I think without the Gede Foundation, I will not have this opportunity to go to school. I'll maybe be hawking in the street, and that is no good for a child. That is child abuse.
And we sponsor children, which we do that through substitution fee, nutrition, uniform, books, and other scholastic material that can help a child to be comfortable in school.
Life wasn't easy for me then. I don't even think that I'll further my education up to the secondary school levels. If I further my education up to the university level and graduated as a professional medical doctor, I won't forget Gede Foundation and I won't forget my country, Nigeria, because as a medical doctor, I will own a hospital. This is my dreams, to own a hospital. Gede in Fulani language means hope. So Gede, to me, the way I look at their works is to build to bring hope in Africa.
And when you see them, you think of all the other lives that are affected because one member of the family was lost. But these children provide hope for us.
What I hope for is a time when everybody would have been educated enough, would have been resourced enough, would have built up enough enthusiasm to contribute to all aspects of HIV's interventions, including taking care of orphans and vulnerable children. Because they were not the ones that killed their parents, and as such, they should not be left out there to face the vagaries of life without any assistance, I think.
One wants to be a lawyer, the other wants to be a doctor, and Henry, I think he wants to be an engineer. If these kids can have that hopefulness when they are in such a dire condition, will you not help them?
I'm happy because I have the opportunity to be here with you. So many people, they would like to have this opportunity, but they didn't get it.
To really appreciate for what Gede Foundation has done for us. Then through them, our pupils, they're now able to do some skill that they will benefit them.
What we want to do is to make sure that that hope is translated into better lives. And somehow we are succeeding because it is not just us who are giving them hope. They are making us hopeful as well.
I believe that Gede is going to do more because the children, all their hope is lying on Gede. Their future is lying on Gede.
Gede Foundation happens to be one of our local NGOs that are collaborating with us in the fight against HIV. This partnership, I hope, will continue to expand so that at the end of the day, Nigerians will be better off for it.
But we just have to expand. I believe that's the next step for Gede.
If there's any organization or any individual thinking of doing something to touch lives, you could do that through us in Gede Foundation.
This is a foundation that is truly out to promote health and wealth for the people of Nigeria and Africa at large.
The goal that I see now is for us to be a leader in the comprehensive approach towards helping or supporting people living with HIV/AIDS, starting from the time they are diagnosed to their antiretroviral therapy, through helping their children.
I would love to invite everybody to visit our website, to visit Gede Foundation facilities, to talk to some of our patients, to visit the orphans that we are dealing with, and talk to them. But we need money to continue to do what we are doing. I would invite everybody, please donate to Gede Foundation.
My hope is for people with hearts, small, big, to give back. Giving back gives you a full heart.
And I see Gede Foundation as a beacon of hope for everybody in Nigeria.
Thank you for spending time with us. There is hope. Think of the good that your money will do. Think of the women. Think of the children. Please make a donation to Gede Foundation.